Assalamu alaikum. In today's video we will discuss about the different ECG rhythm. Here I will draw the simple ECG rhythm with sinus rhythm is when the heart rate is between 60 and 100. We call it sinus rhythm, which is the most normal rhythm in ECG. We call it normal rhythm. So the second is sinus bradycardia. Either the patient heart rate when less than 60, we call it bradycardia. So if we look at this ECG, the distance between the two aura complex is increased, which mean that the patient is sinus bradycardia. Sinus tachycardia, when the distance between the aura waves become decreased, we call it sinus tachycardia. In sinus bradycardia, the rate will be less than 60, and sinus bradycardia, the rate will be greater than 100. So here is the ECG of ventricular fibrillation. Ventricular fibrillation is like when the ventricle is not contracting but it's fibrillates like this. So we call this ventricular fibrillation. What is the treatment of choice for ventricular fibrillation is the DC cardioversion. Here is ventricular tachycardia. When there is a broad QRS complex, we call it ventricular tachycardia. If I show you sometime the real ECG, you will see the ventricular tachycardia is just the same picture like this one. This is atrial fibrillation when the atria become fibrillates and there will be no P waves on ECG. If you find no P's on ECG with irregular complexes, the distance between the aura intervals is very irregular. We call it atrial fibrillation. Atrial flutter is when there is a small fibrillary waves like this one. We call it sawtooth appearance. This is called atrial flutter. Supraventricular tachycardia, when the tachycardia can occur because when the origin of the tachycardia is above the ventricle, we call it supraventricular tachycardia. And the treatment of choice for supraventricular tachycardia is carotid massage, Valsalva maneuver, as well as adenosine, and then we go for beta blocker and calcium channel blocker. The last one is Torsades de Pointes and systole. Torsades de Pointes is monomorphic and polymorphic. The treatment for Torsades de Pointes is magnesium sulfate. And this is asystole. Asystole is a non-shockable rhythm, and we start with IV adrenaline. So these are the most common pattern we see in OD labs and emergency department and cardiology unit. All these pattern, sinus rhythm, sinus bradycardia, tachycardia, all these things. Hope this lecture help you to diagnose the patient quickly and effectively. Thank you.